Everybody, Brandon and Kyle back here at the Pinky Strength Studios. We're going to be talking about hip pain and potentially some causes that are less common than just tight muscles. And what we're talking about is nerve pain. So there's a lot of nerves and things that run through the hips, and sometimes a nerve that becomes entrapped or isn't allowed to move as freely as it should produces pain in various points, and sometimes it can be very specific to the hip, but sometimes it can travel into the lower back or even down the adductor. So we're going to show you two different drills that we really like for flossing the hips. Now, when we say flossing the hips, we're not talking about using floss bands or compressive bands. In fact, you probably don't want to use those if the nerve is your problem or if the nerve is entrapped. What we want to do is create some space at those joints and allow them to actually move and glide the way they are intended to. So the first one we're going to show you is on the wall. Now the setup with this drill is pretty important. We're going to get Kyle on the wall here, and his foot's going to be angled up onto the wall halfway. Now, that doesn't seem like a real important detail, but it really is. What we do when we angle the foot at the wall there is we actually lengthen all of this connective tissue. We pre-tilt Kyle's hip slightly so we have even more tension placed on this hip. Now, the key with this drill is to push and pull with this hip back and forth with as big of a range of motion as you possibly can. This hip's doing nothing, this leg's doing nothing. We're really pushing and pulling at this hip, and we want to have a nice, get going into that as far as you can there, Kyle. Good. Not quite that far. We don't need to go into a lunge. Back, forward. It's not a huge range of motion here, guys, but we're really trying to isolate this hip and allow it to glide back and forth. That's going to get all of those nerves and all the connective tissue, everything in there moving as it should, hopefully. Now, we don't need to do this for like a contract relax or anything like that. We're looking for probably 15 to 20 reps per side, and this would be a fantastic drill to do either after training, before training, or on an off day. If you have hip pain when you sumo deadlift or you squat, give this a shot prior to training. The next one we're going to show you.
Quick question on this one. Bent leg or straight leg, which
Straight.
you prefer?
Yep, straight.
Really important to highlight. It can be easy for this knee to start to bend, especially if the structure through here is tight. We'll start to bend and rotate away. Remember, it's this hip capsule that Brandon's talking about that we move. Now I'm moving two joints. We want to isolate that to floss just the hip.
Mm-hmm. Next one is called the hip side shift that we really like. Go and get in position here, Kyle. Very similar to the last one, and just like the last one, we really want to focus on that posted hip as much as we can to glide back and forth. Show them what it looks like there, Kyle. Same thing with this one. We're looking for really high reps here, and we're looking for really intentional movement at the hip. This is not a drill that we want to just rock back and forth and feel a stretch. If you feel a stretch, that's great, but that's not really the intent of the drill. The intent is to really floss that hip capsule and get some movement established at it. You want to talk progressions here, Kyle?
Yep, so one of our favorite progressions with this is just starting to lift up the foot because we're talking flossing of that joint. However, there's so much stabilizing musculature around this ball and socket joint, very similar to the shoulder. So it's awesome to be able to move it through its range of motion, but we also want control. I used to do this drill a little bit better. I'm not the best at it, as we just found out, but at multiple places through here, I should be able to pick up this foot without major crashing or realignments of the body. So I'm pretty strong here. I can support pretty well, pick up the foot without a lot of shifting. As I get closer to midline, it becomes a little bit harder. And as I come out here, I just don't have the stability. I have an adductor that's not very happy with me right now, and it's pulling a little bit. There's definitely not stability there. There's not a balance. And to do so, I really have to lean out of alignment, which we don't want. Through both of these drills, I don't want to be crushed and turned. I want to have good basic structure and alignment through here as I floss this direction, and then as I take it advanced and start to lift that foot off the floor.
Brandon, Kyle out.